Okay, so welcome back to conversation I'm having with Zoe Sharp, physiotherapist. So would you like to just introduce yourself?
Yeah, so I'm Zoe and I'm a musculoskeletal physio and I've been doing pelvic health physio for the last 6 months.
Great. And real passion for women's health, haven't you?
Absolutely, yeah.
Yeah, and I think she has to have really because she has to deal with a lot of female anatomy, don't you?
Yeah.
And it's really refreshing. I found it really refreshing meeting Zoe because I'm also really passionate about women's health, and I'm also really aware from the amount of women that I work with how many women are maybe not living their life to the full because of issues they have as being caused by their pelvic floor weakness or whatever's, traumatized that area over time. So today we're going to talk about prolapse, and I think prolapse is quite a scary word, and probably one of the things that most women probably would be really frightened to hear that term if they were told you've got a prolapse. And maybe for some women as well, with the internet, going and searching themselves, trying to find information, they end up finding some quite scary pictures maybe, and information that's really difficult to apply to them because they don't really know
Yes.
what's going
Yeah.
on. And
Yeah.
so, if let's start today with what is a prolapse.
So a prolapse, definition wise, it's laxity within the vaginal walls. And if you can feel a bulge, heaviness, a discomfort, or you're getting some urinary symptoms or bowel symptom issues alongside that, it might be classed as a prolapse. But it's really important that you go and speak to your GP and have that investigated so you can make sure they get you on the appropriate treatment kind of going forwards.
Okay, so if a woman, for them to or even think that they might have a prolapse, so let's just backtrack over some of the things you've said. So a bulge,
Yeah.
so that's internally
Yeah.
and externally
Yeah,
as
it can
well.
be, yeah. So if you feel like there's a bulge in the vagina, say if you sit down and you feel like almost like you're sitting on something, or if there's a
Right.
heaviness or a general discomfort and things don't feel quite right inside the vagina, or like you say in more severe cases outside of the vagina, then it could be potentially a prolapse.
Right. Okay. One of the things that when I went for my pelvic floor physio is I felt like there was like a weight bearing down, like a dragging
Yeah, yeah.
sensation, and that's what worried me, that I might have a prolapse.
So
Dragging sensation.
So the dragging sensation, that could be some laxity in the vaginal wall. So whether that can be the front wall of the vagina, so the wall that sits more kind of at the front where your bladder is,
Yeah.
or whether it's the back wall of the vagina, which is where your bowel and your rectum is. So it can be slightly coming into the vagina, whether that's from the front or the back or downwards uterine, but that's less common. It's mainly the front wall is the most common. That laxity coming slightly into the vagina can cause that heaviness and that dragging feeling.
Right. Okay. There. So what might cause a prolapse then? What can cause it?
It tends to be laxity in the pelvic floor.
Right.
So whether that's a little bit of weakness in menopause,
Right.
whether
So
that's
that's, I
that
suppose, what I'm
constant
getting at. So
stress.
what brings on that laxity, I
Yeah,
suppose, is the
so
better question.
so it could be many, many different things. And it's similar to what we spoke about before. So whether it's a chronic cough, that's extra strain through your pelvic floor over a period of time that could cause it, the connective tissue disorders that could cause some increased laxity, pregnancy, so having kind of many, many children, vaginal deliveries, instrumental deliveries, that increases the risk.
Right.
And the
Okay.
same with menopause, there is an increased prevalence, but it's not always it's going to cause a prolapse, but it does increase the risk of a prolapse.
Right. Okay. So for women, if they think they've got any of those kind of
Yeah.
symptoms,
Yeah.
then is the process much the same going forward as it
Yeah.
would be we've talked about before in terms of getting support? So should we just remind what that might look like?
Yeah, so with a prolapse, if you don't have any symptoms and it doesn't really bother you, but you think you might have a prolapse, you don't have to do anything about it. You can leave it as it is. You can go to the GP. They might suggest that you see a pelvic floor physio. They might suggest that you see a gynecologist for kind of different options going forwards. It depends on what kind of treatment you want going forwards and what your goals are really.
Right.
And
Okay.
the extent of the prolapse as well.
Yeah. Okay, so there is treatment plans. There are ways of dealing with. Again, women shouldn't put up with that.
No.
You know, not thinking that this is it.
Yeah.
And
Yeah, so with pelvic floor physio, you can definitely improve the symptoms of a prolapse. You can't necessarily reverse it, but you can definitely kind of get on top of the symptoms, improve the feeling, and it depends on what symptoms you're getting, whether you're getting issues with kind of urinary issues, so leaking, those kind of things. You can make improvements on that side of things.
right, okay, and that's brilliant to hear, because you know there's always this worry about surgery, isn't there? I've got to go and have surgery. So to know, for women to know that you could go and have some physiotherapy, and it might get you to the point where you're happy with that. That might then mean that you don't have to go down the route of surgery.
Yeah, and there's also the option of pessaries as well. So the GP could refer you to the gynecologist or potentially to a pessary clinic to see if that's a suitable fit for you as well. So something inside to support those vaginal walls to make it more comfortable for you. And you can still do your pelvic floor exercises if you have a pessary as well.
Right. And are pessaries kind of a long-term thing? Someone could have a pessary for quite a number of years?
Yeah, absolutely. There's lots of different kinds out there. There's some that you can go and get changed every 4 to 6 months. There's some that you can put in yourself and take care of yourself. It really depends on your goals and what you're trying to achieve and how you want your management to look like to what might be offered from the GP or the gynecologist.
Right. So that again is great to hear, isn't it? Because it's non-invasive in terms of surgery, which, you know, we've heard. I know one of the things that was discussed when I was going through my journey was, well, you could have surgery, but surgery, I think I got shown 3 different types of surgery that might work for me, but it was only 75% going to work. So, you know, and that to me wasn't high enough odds for, you know, I didn't feel, for me personally, that was high enough odds for me to put myself sort of through that.
Yeah.
For some women, I suppose it might be, dependent on how bad things are. But again, it's like, you know, to have a device, I suppose, of some sort that can be used sounds like a great idea. And maybe for women who are slightly older as well, it's a good option, isn't it, I suppose?
Yeah, it's a personal decision that you should make with your healthcare professional, but there's lots of different options out there, and there's a few different options for conservative management that you can always try before considering things like surgery, for sure.
You mentioned a pessary clinic. I don't think I'd ever heard of pessary clinic before, but I probably wouldn't need to. But can you just what is a pessary clinic then?
I think it's just specialist healthcare professionals that would fit pessaries.
Oh, really? Okay.
Yeah, so it tends to be healthcare professionals that have had the specific training, and they have lots of different pessary options, whereas if you go to kind of your local service, they might only have limited options of pessaries.
Right.
And if they don't work for you, then it might be that you go to a pessary clinic that's got lots of different options to try, because it can take 3 or 4 before you find the right one for you.
I was going to say, it sounds like it could be a bit of a journey then to get to that right
It's
right
trial
place.
and error, like many things.
Yeah. Just because we don't want to get too technical today, but if somebody had a prolapse, I mean, it would really depend, I suppose, on how bad the prolapse was and what was involved. But how long could a woman expect to go through treatment before they got a reasonably good response? Just average, what would you say?
So I think the guidelines are that they would recommend 3 months of physio before considering anything more invasive, for example. However, everybody's very different, and everyone's kind of responds differently with their pelvic floor exercises. It depends where your starting base is and what your goals are that you want to achieve. You would want to be doing at least 3-4 months worth of consistent pelvic floor exercises before you're going to notice a good difference. For some people it's a lot shorter, some people it's a lot longer.
Right,
so it's very personal and it's very individualized.
So, you know, say for instance you and I both had the issue again, it comes back to this whole thing, it could be very different, couldn't it, for either of us?
Absolutely.
And what we shouldn't do is, you know, yes, we must talk. I do think women definitely need to talk about this much more.
Women do need to talk about this more, yes.
You know, this is kind of one of the things I want to achieve from us having these conversations, is get it out there, get women talking about it, but also understanding that if you talk to somebody who's maybe not had the the best response so far, or maybe they stopped because of whatever reason for them personally, doesn't mean to say you're going to have the same issues. And I do worry about that, because I think when we do pluck up the courage to speak to somebody, then if we don't get the right message back, that might put us off and stop us from progressing that any further.
Yeah, I think you need to advocate for your own health, and I think that's really key with the NHS at the moment. Sometimes you just need to know a little bit more about what direction you want to go in. So there's lots of information out there. So if you have a look at the POGP website, have a look at their information on prolapse and treatment, and get an idea of what's out there and kind of what you can do for yourself, when to seek help, and just be more informed with the decisions that you're making, because it can be off-putting when you don't get the response that you want, but the more informed you are, the more confident you will feel going into those appointments.
Yeah, definitely. So what was that website again?
POGP website.
POGP website.
POGP.
So I'll put that in the comments.
Yeah,
of the,
loads
of
of
the
really
video.
good information, patient information.
So it's patient information, not geared up at health professionals. So it's going to be...
It's both. It's full of both, yeah. But it's worth having a look at all of their patient information leaflets for anything pelvic related.
Right, okay. And if somebody is, if you had to give somebody a bit of a tip really on how to move forward, what would you say to a woman? So if a woman was like, if I was sat here with you now, Zoe, saying, it's a scary thing, I don't know what to do, what reassurance could you give me for getting on those first steps of the ladder to getting my prolapse sorted out, or thinking I've got a prolapse?
Well, I tell you not to Google it, and definitely don't Google image it, because that will scare you.
Right, okay.
But definitely just go to the GP, reach out, make that first steps, giving the GP a call, finding out what your local services are, and seeing where you need to go for your best treatment. It's reaching out and making that first step.
Yeah. I think they're really good tips, and I just hope that if you're listening to this and you hear what Zoe's saying, I think, really take that advice, because again, I think, about my 7-year journey, everything I've learned during that time, and I'm learning now, I think there is no way. I mean, luckily I didn't have a prolapse, but there's so many things I could have done to resolve my situation so much faster. So this is great information, and just, have a little look at what's out there and available, and then inform yourself really. And I think this whole advocate, we do have to, don't we? We have to advocate for ourselves, really, and, go and seek help from those people, because, going to your GP might sometimes feel like a big step and a big move, but that's what GPs are there for, aren't they?
Yeah, absolutely.
So, So anyway, hope you found that useful today. And Zoe and I will see you back here on the next conversation.